My name is Molly, and I will be doing an assessment on my patient Joe. So first, we will look at Joe and see that he look at his demographics and see that he is a white male, 34 years old. And so I will start by introducing myself, doing hand hygiene, and asking what brings you into the clinic today.
I've had a couple of weeks of nosebleeds.
Nosebleeds, okay. So when did they start?
A couple weeks ago.
Okay. How often are you getting them?
Usually about once a day, if not more than once a day.
Okay. How long are they lasting?
A couple hours.
Okay. Are you bleeding anywhere else other than your nose?
No, just the nose.
Okay. Any pain associated with the bleeding?
A little bit.
Okay. Can you kind of tell me where that is?
More in the upper part of the nose.
Okay. On a scale of 0 to 10, what would you rate that at?
It was 3.
Okay. Describe the pain.
Just kind of a dull ache.
Okay. Okay. Is there anything that makes the pain better?
Usually when I put something in there and kind of depress it and down.
Okay.
So like that.
So I'm sorry, that makes the pain better. Does that also make the bleeding better?
Yes.
Okay. Does anything make the bleeding or the pain worse?
If I blow my nose or something and dislodge something, then yeah, that'll be worse.
Okay, so blowing your nose makes it worse?
Yeah.
Okay. Let's see, is it radiating anywhere else?
No, just about the nose area.
Staying localized to the
Yeah.
nose? All right. Let's see. Are you having any cough with this?
No, I did have a little bit of a fever though about a week ago.
Did you have a fever? Okay. Let's see, any other nasal drainage that you've noticed?
No, just that.
Okay. No clear?
No.
Okay. Are you short of breath?
No,
Have you noticed any rashes?
have not.
Okay. Have you had any recent exposure to any infections?
Nothing, nothing recent, no infections.
Okay. Have you been exposed to anybody, maybe at work or in a family?
Not that I know of.
Okay. Do you have any history of allergies?
I have a dairy allergy, yeah.
So food.
Food allergy,
Okay.
yeah.
Any seasonal allergies?
No, usually I'm pretty good with those.
Okay. Let's see. Any medication allergies?
Not that I'm aware of.
Okay. Are you taking any medications right now?
Right now, just some nasal sprays.
Okay. What are those?
Afrin.
Okay. How long have you been taking Afrin?
Oh, a couple weeks. I thought it may help with the nosebleed and whatnot.
Okay. Are you on any other anticoagulants?
No.
Maybe aspirin or an NSAID?
Well, yeah, I would take aspirin every now and again. Is that an anticoagulant?
Why do you take aspirin?
Well, more for the little bit of pain, and I don't want it to radiate into a headache.
Okay. Okay. Any prescription medications?
No, nothing prescription.
Okay. Let's see. Do you have any pets?
Nope.
No pets. What do you do for a living?
I work at a corporation.
Okay. So are you outside?
Inside.
Inside. Okay. Okay. Where do you live? Do you live in a home or an apartment?
Yep,
or
at home.
Okay. Okay. Let's see. What about other medical history of yours? Do you have any history of like vascular disorders?
No, nothing on my side or my parents' side.
Or bleeding disorders?
No bleeding.
Any liver disorders?
No, my grandmother has low blood pressure.
Okay.
Typically, but no blood disorders or anything like that.
Okay. Let's see. What else? Any other medical history for you right now?
No, nothing for me. I'm generally pretty healthy.
Okay. Do you take any illicit drugs?
No.
No recent cocaine use?
No cocaine use.
Okay. Any recent trauma that you remember? Bumping your nose into anything?
No.
Nothing getting stuck up there?
No.
Any nose picking?
No.
Okay. Are your immunizations up to date?
Yes.
Okay. What about surgical history? Have you had your tonsils out?
Nope.
Okay, any gallbladder or
No.
appendectomy,
No.
anything like that?
No, just my wisdom teeth.
Wisdom teeth? Okay, when was that?
15 years ago.
Okay, so about 2002?
Yeah,
Okay.
sometime around there.
Okay, what about your family history as far as your parents, your siblings, any medical history for them, diabetes,
Yeah,
cardiovascular
my dad
disorders?
has diabetes.
Okay,
My mom is generally pretty healthy, maybe a little overweight.
okay. Any medical problems with your sisters?
No,
Do any of the allergies run in your family?
no,
Okay. Let's see. What about, do you smoke?
no, not a smoker.
Okay. Drinking?
I mean, I don't drink often, once, twice a month type thing.
Okay. What about exercise?
I usually try to get out and at least walk once a day, if not more.
Okay. What about diet?
Generally pretty healthy. I try to eat at home. Just meats, vegetables, starches, stuff like that.
Okay. And I think that about wraps up your history section of it.
Okay.
Let's see. I know the nurse grabbed your vital signs before you came in here. You didn't have a fever today. That was 98.2. Looks like your blood pressure is 112/68.
Okay.
Your pulse was 66 and your respirations were 14, and your pulse ox was 99/100. So all that looks really good.
Okay.
I'm going to go ahead and do a nose assessment on you,
Okay.
as well as probably look in your ears, take a peek in your throat, and listen to your heart and lungs.
Sounds good.
Alrighty. And just right after that, hearing his health history, his differential diagnosis would be some mucosal dryness, irritation, and possible infection. We might be looking at some sort of vascular disorder or hematologic disorder. Just from his health history, I can probably rule out the other two, the vascular and the hematological disorders. And we can kind of cue in on the mucosal dryness, irritation, and possible infection because he had a fever last week sometime. And we can also possibly look at Afrin as a cause, as a contributing factor to the nosebleeds as well. So, and possible seasonal allergies as well. So we will go ahead and get started with his examination. I'll grab my stethoscope.
Okay.
All right, and I will look in his nose to start out with here. All right, so I'll first take start by looking at his external features, noting that the bridge of his nose and the tip of the dorsum, that is all nice and symmetrical and in line. I don't see any noticeable lesions, any masses. I don't see any noticeable swelling. Let's see. And I'm going to also palpate it a little bit. Is anything tender in here?
No, it's tender.
Okay. And while I'm at it, I might just go ahead and palpate his sinuses, his frontal and his maxillary sinuses. Is anything tender?
No, it feels good.
Okay. All right, so we're going to take a peek up your nose and see what we can find anything here. So I'm going to just try to keep his head still and put this in, take a peek. Very good. Now look at the other one. We'll look at all, try to see the whole inside here. And you see that his the inside of his nose, it looks red and beefy a little bit, but I don't see any polyps, any lesions, any open active bleeding areas. So I would say that is probably indicative of some allergies. It looks like I didn't see any other drainage. There's a little bit dry and crusty redness inside. So that is probably where some of that bleeding is stemming from. I'm going to go ahead and take a peek also in his ears. We're going to do a little guy here. Take a look at his ears just because he is having nosebleeds. I'm going to... Are you having any ear pain?
No, nothing out of the ordinary.
Okay, so that is good. Since he's an adult, I'm going to pull up and back on his ear. Kind of hold this like a pencil here. I see that his jam is nice and white and pearly. And again, he looks nice and white, pearly. No signs of redness, no signs of obstruction, perforation. His ears look really good. And again, also we can palpate, probably should have palpated before, make sure that there's no tenderness. His auricle they're all nice and in line, it is symmetrical. No masses, no lesions, no noticeable drainage. There was really no earwax inside there, nothing obstructing. Have you had any hearing problems lately?
No, I'm hearing just fine.
Any vertigo?
No vertigo.
Okay.
Feel pretty stable.
Okay, very good. Well, we will go ahead and take a peek at your mouth as well here.
Okay.
Okay, so I'm going to start out by looking just on the outside of his mouth. It looks like his lips are pink and moist. I really don't see anything, any cause of concerns from the outside. I'm going to have him open up his mouth here wide, and I'm going to take a peek any sensitive areas along your teeth here. I don't see any causes of concern as far as dental caries here. Let's see, we can also kind of check for gingivitis. His gums look nice and pink. His buccal mucosa looks nice and pink. I don't see any redness, any white spots, any masses, lesions, anything abscesses. I'll check his salivary gland. That looks nice. I see that. Does not look obstructed. You can also go ahead and stick out your tongue. You can say ah. So I can note that Joe still has his tonsils. I don't see any redness, swelling with those. No white spots on there. Let's see. The roof of his mouth is also intact. We can check his frenulums as well. Go ahead and lift up your tongue for me. Very good. And we'll check his other frenulum. Very good. So no causes of concern in his mouth. All that looks nice. He'll go. I'm going to go ahead and listen to his lungs and his heart here. And I'm going to start with his heart. So I would be listening on the inside of his shirt, but just for privacy, I'm going to leave that down for him. So I'm going to check the aortic, and then the pulmonic, the Erb's point, tricuspid, and the mitral valve. And I would do that again with the bell as well. After I do that, and I'm going to listen to his lung fields here. So if he takes nice big deep breaths, listen to both sides bilaterally. I will do that also on his back here. Listen to all the lobes. And again, I would be doing this underneath his shirt. Very good. And I also, I'm going to go ahead and assess his lymph nodes, just because he is complaining of some of the nosebleeds. I just want to make sure his lymph nodes aren't flagging for infection as well. So we're going to be starting out, we're going to look at we're going to find his preauricle here. We're going to go to his posterior auricle behind the ear. We're going to look at his tonsillary. We're doing this bilaterally here. And his submandibular and his submental. We're going to look at his occipital nodes back here. And we're going to look at his superficial cervical chain and his posterior cervical chain. And if you go ahead and, can you turn your head to one side for me? You can feel the deep cervical chain better if any of his lymph nodes are tender or swollen. Has any of this been tender for you? You can really look that way as well.
No.
No tenderness?
No tenderness.
And then we'll also check his supraclavicular and infraclavicular. So I don't feel any signs of swollenness or tenderness on his lymph nodes as well. So again, I think we talked about his differential diagnoses being for his nosebleeds, because his chief complaint was nosebleeds, the epistaxis here. Mucosal dryness, irritation, infection is one that I believe we'll go ahead and diagnose him with, but we also kind of looked at vascular disorders and his hematological disorders. He doesn't have any health history. His family doesn't have any health history. It's likely just environmental dryness, because it is allergy season, and his family has a little bit of history with seasonal allergies. So he's also been taking Afrin for way too long. So we will educate him on that and come up with a plan to get him having reduced nosebleeds. And we won't refer to an ENT at this time. We will just go ahead and treat and come up with a plan as is. So thank you, Joe, for coming to the office today.
Thank you,
We'll get you feeling better.